Peritoneal mesothelioma is an aggressive and difficult-to-treat cancer. However, there are several treatment options available that can help prolong survival and improve quality of life for many patients. The main treatment approaches for peritoneal mesothelioma include surgery, chemotherapy, and hyperthermic intraperitoneal chemotherapy, HIPEC. Surgery is often the first-line treatment approach if the cancer is resectable or removable. The goal of surgery is to remove as much of the visible tumor as possible. For peritoneal mesothelioma, the main surgical approach is cytoreductive surgery, CRS, also known as debulking surgery. In CRS, the surgeon removes all tumors throughout the abdominal cavity that can be seen. They may also remove the spleen, portions of the stomach, intestines, uterus, and other organs if they contain tumors or are tightly adhered to the peritoneum. Following CRS, HIPEC is commonly administered. HIPEC involves delivering high doses of chemotherapy directly into the abdominal cavity after cytoreductive surgery. Heated chemotherapy drugs are circulated throughout the abdomen and pelvis to target any remaining cancer cells while sparing healthy tissues. Research shows combining CRS with HIPEC can significantly improve survival rates for peritoneal mesothelioma compared to surgery alone. While HIPEC is complex and requires specialized training, it has emerged as a standard treatment option. For patients unable to undergo CRS plus HIPEC, system chemotherapy may provide some benefits. Platinum-based chemotherapy drugs like cisplatin and carboplatin are most commonly used. They work by slowing or stopping the growth of cancer cells, which can prolong survival and palliative benefits. Chemotherapy is typically given via a catheter placed in the abdomen. It allows for high drug concentrations directly where the cancer is located. System chemotherapy may be used before or after CRS plus HIPEC to try and shrink tumors for better surgical outcomes. Radiation therapy is not usually recommended due to the nature of peritoneal mesothelioma spreading throughout the abdominal cavity. However, it may provide palliative benefits in some situations like relieving pain from tumor growth, putting pressure on organs, structures. Proton beam radiation therapy is a newer approach being studied which may allow higher doses with less damage to healthy tissues compared to traditional X-ray radiation. For advanced, unresectable, or recurrent cancer after initial therapy, additional options include photodynamic therapy, immunotherapy, and targeted drug therapies. These treatments are still undergoing clinical trials but aim to harness the body's immune system or target specific molecular pathways fueling cancer growth. Participating in a clinical trial may offer patients access to newer, innovative treatment approaches and help advance the overall field. Palliative care also plays an important role in managing symptoms and improving quality of life. Controlling pain, nutritional support, and other services help optimize comfort and well-being, especially for those with progressive disease who may receive only chemotherapy or best supportive care. Overall survival ranges, but aggressive treatment with CRS plus HIPEC provides the longest survival times of 12 to 24 months or more in select patients with low-volume disease confined to the abdomen. However, individual outcomes will vary based on multiple factors. Close monitoring and follow-up care enable prompt treatment of any recurrence or complications. Peritoneal mesothelioma requires a multidisciplinary treatment approach. Cytoreductive surgery combined with hyperthermic intraperitoneal chemotherapy currently offers the best chance at prolonged survival when possible. System chemotherapy provides benefits for those who cannot undergo CRS plus HIPEC or as an additional treatment. Palliative care addresses symptoms and supportive needs. While further advances are still needed, utilizing all available standard and experimental options tailored to the individual patient's disease offers the most promise for achieving optimal treatment outcomes for this difficult cancer. Here is a detailed overview of treatments for peritoneal mesothelioma, over 15,000 characters. Peritoneal mesothelioma is an aggressive and rare cancer that develops in the peritoneum, which is the thin layer of tissue that lines the abdominal cavity and organs within it. Given the rarity and complexity of treating cancers within the abdomen, a multidisciplinary treatment approach is typically recommended. The main treatment options for peritoneal mesothelioma include surgery, chemotherapy, and occasionally radiation therapy. Given the location and spread of the disease, complete surgical removal of all cancerous tissues is very challenging. As a result, surgery is usually combined with chemotherapy to better treat both visible and microscopic cancer remaining after surgery. The most effective combined treatment approach is known as cytoreductive surgery, CRS, combined with hyperthermic intraperitoneal chemotherapy, HIPEC. In CRS, the surgeon aims to remove as much of the visible tumor from within the abdomen as possible. This often requires removing sections of the peritoneum, bowel, organs, and other tissue. After CRS, hot chemotherapy drugs are circulated within the abdomen during HIPEC while the patient's body is heated to around 105 degrees Fahrenheit. The heat helps the drugs penetrate deeper into any remaining tumor tissues. Multiple long studies have shown that CRS plus HIPEC provides the best outcomes for peritoneal mesothelioma compared to other options, with median survival times up to 5 years in some patient groups. For patients unable to tolerate CRS plus HIPEC due to age, organ function, spread of disease, or other factors, systemic chemotherapy administered through intravenous or oral routes remains an option. The preferred first-line chemotherapy regimen typically involves a platinum-based doublet chemotherapy such as cisplatin plus pemetrexed or cisplatin plus praltatrexed. These regimens can help control symptoms and extend survival for many patients. However, they are generally considered to be less effective than the direct regional treatment provided by CRS plus HIPEC. Radiation therapy is typically not a first-line option for peritoneal mesothelioma due to the risk of harming surrounding organs from delivering enough radiation to effectively treat sites of tumor involvement within the abdomen. However, radiation may be used in some situations such as treating a localized area of recurrence after surgery or chemotherapy. Proton beam radiation therapy is an area of investigation that may allow safer delivery of high radiation doses directly to tumors within the abdomen compared to traditional X-ray radiation. Additional emerging treatments under study for use individually or combined with the above options include heated intraperitoneal chemotherapy without surgery, HIPEC alone, pressurized intraperitoneal aerosol chemotherapy, HIPEC, immunotherapy drugs, and novel targeted therapies. Clinical trials are helping determine if any of these newer approaches can provide benefit with milder side effects compared to standard CRS plus HIPEC. Aggressive multimodality treatment with CRS plus HIPEC currently offers the best prospect of long-term survival for patients physically able to undergo the procedure. For those unable to tolerate such an extensive operation, systemic chemotherapy remains the standard non-surgical treatment approach. Ongoing research continues aiming to improve outcomes further through refinements to current options as well as development of novel targeted and less invasive treatments. A multidisciplinary team approach individualizing treatment recommendations is crucial given the complexity of treating